So I'm Lauren Dudas. I'm the program director for the general surgery residency program, and I'm also a trauma and acute care surgeon at WVU. I've been here for about 6.5 years, and in the capacity of my trauma role, then I cover the surgical critical care, emergency general surgery service, and then also the trauma service. And then I've been the residency program director for almost 2 years now. I think our biggest strength, and this is what I tell all the candidates when they interview, is really our residents. Right now, they are really working cohesively. Last year, we had the most research productivity we've had ever in the history of the program. We sent over 30 residents to present at different national meetings. They are really helping each other out if there's cases that need covered or if there's an unfortunate circumstance that we need coverage. I think from a clinical aspect, our department just continues to grow. In the past 5 years, Dr. Marsh has helped the department nearly double as far as faculty, which brings a nice variety of case complexity as well as actual variety of cases. So those are just basic strengths of the residency. I think one of the very unique features of our residency program is our fresh tissue cadaver program. We have it built directly into our didactic curriculum. And so throughout their training, residents will be exposed to more rare, open procedures that they wouldn't necessarily get clinically multiple times, at least 3 times. And so that really brings a different level of comfort with some of these more complex cases. And the Appalachian population that we treat is really unique. It's one of the reasons that keeps me here at WVU. But our patients lots of times are fearful to interact with the medical system, which means that we have the opportunity to intervene in their health in a way you don't get in a lot of different areas. So from a critical care standpoint, they come to us more physiologically deranged, and we really have the challenge of getting them back to their baseline and then figuring out how we can improve that baseline because they may have multiple undiagnosed medical problems. Our patients travel from very far away. Sometimes it'll be 4 hours away. They can't get a helicopter. And then there may be the the added level of our geography and the weather. And so sometimes their transport time can be days. And so that also adds to the conditions we get to treat. We get complex medical problems from basically, split the distance between us and UPMC and then the entire state of West Virginia, as well as some areas of Pennsylvania and Maryland and Ohio. So all different people in all different walks of life. Our residents do the majority of their rotations right here at Ruby. So with the exception of an away transplant rotation and a rotation at one of our other WVU hospitals in Ranson, West Virginia, the residents spend their entire residency program here right at Ruby. So it allows for continuity and comfort level of faculty. I think it helps a lot with how our residents feel that they can approach faculty because they are around them all the time. It also makes it really easy if you are someone who is coming here, then you want to raise a family, that you won't be away from your family frequently. Another benefit of our program is we are a 5-year strictly clinical program. However, with the assistance of our chairman, we were able to secure funding for dedicated research time for residents who may be interested in that. So we are trying to make sure that we have our residents ready for graduation and ready to practice independently. About 50% of our residents do go on to general surgery practice, and then 50% of our residents go into really competitive fellowships from surgeon to pediatric surgery. I think having the ability, if you are interested and showed you've been productive in research before, to take a year or 2 off and spend time in the lab or doing clinical research is a really great benefit. And so there will not be a resident from here that can't get that competitive fellowship if they want to. But if you want to be practice ready, we're also the place that you can train. We're so excited that you are interested in West Virginia University as a training facility. Please reach out if you have any questions or check out other interesting information we have on our website.